the submarine inside. So you're sitting in with a big hood, getting pure oxygen at a high pressure. What happens with the high pressure is the oxygen now, as the pressure increases, it's actually pushed into your tissues. So when oxygen usually is in the blood, but when you have high pressure oxygen, it gets into your tissues, it gets to your muscle, your bone, everywhere. In fact, one of the things they do in experiments is if you want to take a heart and want to see how it will survive, you pluck it out from the body. If you put it in a hyperbaric chamber, you'll still survive because it's getting oxygen. Tissue can be oxygenated and kept around by hyperbaric. So that kind of gives you an idea. But to get it more focused for you all, let's talk about stroke. Stroke itself is not what causes the most damage. In other words, you have a stroke in the brain. It's not that particular stroke. It's around that stroke, you have edema. Do you follow me? That's important to understand. So you have a stroke, and around the stroke there's inflammation and edema. The inflammation and edema, that's what causes the most damage. Okay? So if you don't decrease the edema within the first 72 hours, the edema can expand, the inflammation can go up and kill a lot more cells. So if there's a stroke, let's say you kill 10 cells, but the edema and the inflammation around it, if it goes unchecked, that can kill maybe 1,000 cells. So the idea among hyperbaric in Europe, for example, as soon as you have a stroke, they want to get you in the chamber fast. Because what happens is that edema, the area of edema, when the swelling happens, oxygen can't get in. And there's a lot of inflammation, a lot of killing happening. Remember, the brain, if somebody called you a fathead, for example, that's a compliment because the brain is all fat. The fatter the brain is, the better you are. But fat also can become rancid very easily, or rust. So when you don't get enough oxygen and circulation, clear it all out, more destruction happens. So if they get them within the 24 hours, you oxygenate the area of edema, you oxygenate that area and the swelling decreases. And that's one way of looking at it. And actually in edema, in regular in the legs and everything else, when you put in hyperbaric, it gets benefit. Because when you start having swelling, what happens? Circulation starts getting cut off. But with the hyperbaric, you don't need circulation. The hyperbaric, as soon as you're breathing it in, it goes in the blood. From the blood, it's pushed into all the tissues. And that's basically, in a nutshell, what happens. And by decreasing the edema, you do well. Now, what happens to somebody who had a stroke 20 years ago? What happens when you have edema a long period of time, that part of the brain, all the vessels, all constrict. And that part of the brain goes into hibernation, or it's comatose, if you will. When you give oxygen, it all of a sudden starts opening. It's like having a land, having a house in the country. And if you never went into there for 10 years, all the roads are all grown in. But if you start driving through it, it'll reestablish itself. So when you put in hyperbaric, high oxygen therapy in there, it opens up the tracks, if you will. I'm giving you a metaphor, going in there, and all of a sudden, the brain which has been sleeping starts coming back alive. We see that in people who use gunshot wounds, where around the brain, when you do a PET scan, it's all dead. But when you oxygenate, all of a sudden it starts lighting up. So it's amazing what hyperbaric can do. But the trick is to get, sooner you get in, the better it is. But even if not, you benefit. Because if you get into somebody, if I had a stroke today, and I got into the chamber within, say, 24 to 72 hours, probably 5, 10, I'm fine, out to recover. But the longer the stroke you had, then the more dives are required. Because the brain doesn't scar, but think of it something like that. You've got to keep pushing it to get the brain active. The problem is not just getting the brain active. You have to get active. There's a lot. That's when you do physical therapy, when you're getting the brain active, you get the maximum benefit. So that's why when you're long term, then you're talking about 40, 80 type dives to get to that. Most places the dive costs about $250, $300 a dive. If you go to the hospital, it's about $2,000 a dive. But here, not any, I can't take any credit at all. But when we had this, was owned by a different person. It was more profit oriented. Now, Sarah and Karame took it over, and they want, in her case, she's been doing this all her adult life. They want to work with the wounded warriors, the veterans, and stroke patients, everything, and make it reasonable. So they kind of...
We normally charge $150 a treatment, but for anyone in your group, we'll do 100. We have to keep the doors open, of course.
They
but
showed up, right?
So, so really, they do. I mean, there's nowhere in the
Yeah.
country you can have it
we have
that cheap.
payment plans
And
too.
they're never going to get rich by doing that, but, there are different type of riches. It's what they are, they believe in, and that's one of the reasons I help out functioning as a kind of a ad hoc medical dietitian, however I can to help them.
How do you determine how many dives you need to take? How will you
It
know?
depends. If it's the stroke is new, then you need less dives. But ultimately, it's going to be, as a rule, if it's an old stroke, you wanted about 40 dives. And why 40 dives? It's kind of the experience of people who have been doing this around the country for the past 20 years. Some people may need less, some people may need more. It's hard to tell. But if you do the SPECT scans, you see the patient's scans lighting up by 5, 10 dives. But the trick is, just because the brain is open doesn't mean it's functional. The functionality means you've got to do things. You've got to go out, deal with the life. As you live life, then the more things are there. As things are lighting up, now they start becoming functional.
So, with physical therapy, would it help, or should you do some sort of physical therapy while you're in the tank? I mean, I haven't seen tanks on it.
No, actually in the tank, the best thing is to do, one of the side effects of hyperbaric is you can go hypoglycemic. Your blood sugar can get dropped. Now, if you think about it, that's really beautiful, because when you're in the chamber, your whole body is exercising in a sense, from every cell in the body. Because your metabolism, you're healing at a fantastic rate. So when you're healing that kind of rate, if you haven't eaten something before you go in, your blood sugar drops. So during that time, I tell people, go in there, sit back, relax,
How
take a
long do you
nap.
dive?
Pardon?
How
Dive
long?
is 90 minutes. 60 minutes is the dive, 15 minutes is when you pressurize the chamber, 15 minutes depressurize the chamber. So the 90 minutes, just relax. Now, depending, some people want to watch movies, they can watch movies. Some people want classical music. We have some patients come in who just want to go in. Some of them are like chiropractors and naturopaths who come in for the chamber just to meditate in there. Because they find it really is helping them. It really regenerates them. When they feel burnt out, it helps. So there are many aspects. In my own opinion, in the next 20 years, probably you're going to see hyperbaric chamber in spas, YMCA, and everywhere. Because it depends how much dive you go. If you go up to dive to 1.5, 1.6, I don't think anybody with any problem can go in and will benefit from it. It's only when you get to 1.8 or 2, higher the dive, then you need to have more supervision. So hopefully that'll happen in the next 20 years. It'll become cheap enough that it can be like the chamber. The chamber here, which they own, is almost $500,000. But because it's made in the United States, it's a medical device. If you can make enough of it, like if you go to Russia and you want to buy one, you can probably buy the same thing for like $50,000. So it's not the expense, it's a matter of enough people doing it, becoming aware of it. Okay? I don't want to take too much of your time, but I just want to kind of give you an idea.
It was Michael Jackson sleeping in a hyperbaric.
In the hyperbaric, a lot of people, a lot of the billionaires use hyperbaric chamber on regular basis just for the brain and staying young, because when you're oxygenating, it's getting into the tissues, getting into the skin, everywhere. And we talk about detox a lot. What better to be in a hyperbaric chamber where you're pretty burning up things, your healing rate goes up, everything goes up. That's why I mentioned about the hypoglycemia. Because that automatically your mind says that hypoglycemia, what's happening? It's not a drug. But it's like if you didn't eat and went jogging, you're going to get hypoglycemic. So there you're sitting in the chamber doing nothing, and your blood sugar drops because of the body's working, it's healing.
Now, you said it's kind of like going for a dive kind of thing. Is the same kind of pressure that you have when you're, if you?
Yeah, it's like 20 feet, if you went 20 feet underwater, the
Okay.
same kind of pressure you have.
So, alright, this is kinda off topic, but I'm kinda curious, I used to, dive.
Mhm.
And I was always wondering if it would be okay if I did it again. 'Cause I didn't know if the pressure would really impact my body or whatever. So, it sounds like it might be okay if I.
Yeah, it depends, you know, like when you grimble, when you're going there, you're already in the pressure, the 100% oxygen you're talking about, not, and when you're doing that, your body's healing. But on the other hand, if you're also active and doing things, then you're not letting the brain heal, because now your brain is engaging. You want to get that time to relax, meditate, let the body do, let the brain heal, let it take care of and do what it does best. Okay? Thank you for having me.
Hey, thanks
Very
for-
interesting.